FORA.tv. The world is thinking.
It offends our sense of individual rights of freedom, liberty, and choice. And so, can you fix this problem without going down that path? My answer is yes. And that is exactly what Congressman Devin Nunes, Senator Richard Burr, and Tom Coburn and I are attempting to do by putting out this Patient's Choice Act. Patient's Choice Act, I won't go into the great details of it. I'd be happy to answer that in questions because I want to be mindful of your time. It does a number of things. Number one, let's recognize this tax distortion that exists. The tax distortion, as Ed discussed, is what helped give rise to this third-party payment system. It's what helped give rise to this system that sort of took the individual out of the game, that took the consumer out of the game. And we want to equalize the tax treatment so we get the individual back in the game. We want the individual to be at least as powerful as these other systems we have in healthcare. And so we're not saying, like some Democrats are saying, tax healthcare benefits and send the money to the government so we can build a new system and have new mandates and a new public plan option. We're saying, let's equalize the tax treatment. Let's take this tax benefit and de-link it from the job and reattach it to the worker, so that everybody, regardless of how you get your health insurance, gets this tax benefit. Now, the way we do it, different than every other bill that has tried to do this, is the tax benefits, the exclusion that individuals get, goes back to the taxpayer. We do not use that exclusion money to pay for non-taxpayers, such as refundable tax credits. So the tax money they get right now by having deductibility if they have employer-sponsored health insurance goes to them in the form of a tax credit. $5,700 for families, $2,300 for individuals. The numbers we are looking at right now internally show us that that's on average an $1,100 tax cut for families. This will be, for the vast, vast majority of Americans, a big tax cut. More to the point, you keep this benefit regardless of what happens to you. You keep your job, you change your job, you lose your job, you go work for yourself, the tax benefit stays with you, it's portable. For the refundable population, we do entitlement reform. We come up with savings, we reduce spending, and we use that spending reduction to pay for the fact that these tax credits are also advanceable and refundable. So people who do not have tax liabilities also have these kinds of tax credits. And what we do in entitlement reform are a couple of things. Number one, we say that let's not continue to segregate poor people from the rest of society when it comes to health care. Let's not have those Medicaid patients come into the clinic and the doctor's office and the hospital with poor person stamped to their forehead where they're pushed back to the side of the line. You got to remember, and I don't know where each of you come from, but where I come from, most doctors won't take Medicaid patients. It underpays them, they don't want it, and so you already have rationing occurring. They're already getting, in many instances, second-class health care. So we're saying integrate them in with everybody else. Voucher out Medicaid, a cash benefit for Medicaid families, $5,000 on a card to go in addition to this tax credit. So a Medicaid family under the poverty line, about $11,000, $10,700 to be specific. And then for people up to double the poverty line, that cash benefit phases from $5,000 down to $2,500, and integrate them into the system. Now, insurance. I'll go quickly over to this. We're saying, by the way, these Medicaid reforms save about $1 trillion, and that helps us pay for the kinds of things that we're doing to make sure that the money that go to non-taxpayers come from spending savings. The money that goes to the taxpayers comes from the money that taxpayers were getting under the exclusion. This bill is revenue neutral, tax neutral. That's very important. You can fix these problems. You can have universal access to affordable health insurance in America, even for people with pre-existing conditions, without having the government take the thing over, without new taxes, without new spending. And that's exactly what we're proposing. On insurance, we're suggesting to set up state-based exchanges. These exchanges are voluntary from around. Voluntary for the individual to participate, voluntary for the insurance companies to participate in them, voluntary for the states to set them up. We have incentives for states to set them up so that people can go and have basically like e-health insurance in each state, or in state regional cooperatives if they want to. States can join together to form these exchanges so people can go into the individual market and see on an apples-to-apples basis what kind of health insurance they want, compare and contrast plans. These things we're saying in exchanges, you have to have a system, a mechanism, so that the uninsurable, people who had breast cancer 8 years ago or had prostate cancer, can also get affordable health insurance. Risk adjustment is the tool we use in this. We're also encouraging states, if they want to do risk pools or reinsurance, they can choose to do that as well. The point also is we want to have a basic benefit so that you can give individuals access to affordable health insurance like large multi-state corporations do through ERISA. So each of these exchanges had to have at least a minimum kind of a benefit health care plan without the bells and whistles. A Blue Cross standard option, it achieves the same thing you seek to achieve with interstate shopping, but does it another way, which we believe is easier to pass through Congress. I'm a huge fan of interstate shopping rights for insurance. It's in every other one of my health care bills. But we know from doing this in Congress that there's no way we'll get that passed. So we're achieving it a different way, which is the purpose of having an interstate shopping right is if you're stuck in New Jersey with all of these heavy mandates, you want to buy an Iowa or a Wisconsin regulated plan which has just the basics and is much more affordable. Well, why don't we have these state exchanges where that Iowa and Wisconsin basic kind of plan is available in New Jersey? That's one of the mechanisms we put together in these exchanges. So we give individuals access to more affordable basic insurance that doesn't have all these bells and whistles and all these heavy, costly mandates.